Afternoon. On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled The Patient and Family Advisory Council, Persevering Through the COVID Era. My name is Molly Cleasenberry, and I will be your moderator for this program. Now I'd like to introduce our speakers for the webinar. Rhonda Ramos is the Patient Experience Director at OSS Health in York, Pennsylvania. With a bachelor's in world missions, she started her healthcare career as a Spanish interpreter and patient advocate at her local community hospital. In 2019, she received a Master of Arts degree in Organizational Leadership from the University of Valley Forge. Rob Fritch is the Vice President of Administrative Operations at Good Shepherd Penn Partners. Rob began his professional healthcare career journey as a physical therapist and has enjoyed the opportunity to care for patients and to support program development in various clinical and administrative roles during the past 22 years. In his current role, Rob leads Good Shepherd Penn Partners Patient Experience Initiatives and supported the launch of their Patient and Family Advisory Council in February 2021. Rhonda, I will now turn the program over to you.
Thank you so much, Molly, and what a pleasure and honor it is to be here with all of you today. Our objectives will be to summarize an approach to implement a PFAC at your organization, recognize 2 qualities of a suitable PFAC advisor, and provide examples of how a PFAC can collaborate with your organization to improve patient and family engagement or other initiatives. So as we get started with today's presentation, again, thank you so much for having me. It's such a pleasure to be here. I am currently employed at OSS Health, which stands for Orthopedic and Spine Specialists, and we're located in York, Pennsylvania. We do have additional locations in Hanover, Gettysburg, Mechanicsburg, and Columbia. We are proud to be physician-owned and operated with approximately 40 physicians. About half of those are orthopedic surgeons. We have about 20 advanced practice providers and about 800 employees. So in addition to our clinic sites, we also have our very own orthopedic specialty hospital located right here in York. We also have an outpatient ambulatory surgery center, 2 outpatient pain centers, one in York and one in Mechanicsburg. We have orthopedic urgent care provided at most of our clinic offices. And we also provide primary care, rheumatology, sports medicine, outpatient therapy, high-end imaging, etc. So as far as our Patient Family Advisory Council goes, we started in 2015 with approximately 4 to 5 people, and the group met quarterly. At the inception, really the goals were to educate the patient and family members to the OSS culture, what a PFAC is, what their role as advisors should be, etc. So after several years of meeting that way, in 2021, then we transitioned to monthly meetings, and by then the council had grown to 10 people. I joined the organization in the end of 2020. I'm coming up on my 2-year anniversary. So it was during that time after I had started that we made some changes. We were meeting virtually, but now, since obviously things have changed, we've been able to now meet in person again. However, we do still have virtual meeting as an option. We do provide lunch for those who are able to attend in person. So the hour that we meet is from 12 o'clock to 1:30, with the first half hour being lunch, followed by the presentation. As the Patient Experience Director, I do chair the committee, but we certainly have other members from our Patient Experience Department on as well. And we are the only PFAC for the entire organization. We don't have any additional subcommittees or other PFACs. It is just this one group that does meet. As far as recruitment goes, it is done organically, typically just by word of mouth. So if we receive feedback from a patient that's constructive, it's thoughtful, well-written, bringing some solutions to the table, typically if we receive feedback from a patient like that, that's when my ears perk up, because then I'm thinking, okay, this could be potentially a good candidate for this council. We want people that are able to present their ideas clearly and concisely, but also bring solutions to the table. That's really important. So if we receive feedback like that, then we would consider offering them an application. We also have PFAC information on our website. As you can see, a screenshot of that is here, just as another way to kind of publicize our group, allow others to reach out to us if it's something that they're interested in. So on our website, we include what is a PFAC member, what their time commitment would be, and some characteristics of what we are looking for in a Patient and Family Advisory Council member. I will tell you, since we made these changes to our website, from my experience, I don't believe we've received any recruits from the website. Instead, it has been through that organic word of mouth kind of recruitment. Most recently, the 2 newest members that we've had join were simply friends of some other members on our advisory council. So the one gentleman had recently had a procedure with us. They were sharing their experience with their friends, and it was through that relationship that they recommended this particular couple for our council. And so through conversation and reaching out to them, it did turn into an application and then a commitment from them. So that is typically how we do recruit, and that is what has worked pretty well for us. But we certainly want to advertise it. Like I said, with our website is just a great way to kind of get it out there and get people interested. As far as the agenda goes, it is developed by the chair, and then it is also sent out prior to the meeting. It includes a rotation of guest presenters on a variety of topics and departments. So no meeting looks the same. We're always bringing in new faces, new people to present their topics. And I usually try to schedule my presenters at least 2 to 3 months out. And then those meeting topics are shared in advance for planning purposes and to gain interest of the community members. So if they know that there's a presenter coming up in a few months and it's a topic that really piques their interest, that's another reason why I try to book it several months out, so that then they can make arrangements to ensure their attendance so that they can participate. I always encourage the presenter to ask the group for feedback during their presentation or at the very end. Our Patient Family Advisory Council members are very engaged, and they love to provide their feedback. And if we don't afford them that opportunity, then they don't necessarily feel like they are doing their job, and could potentially feel frustrated like we're not utilizing them appropriately. So we always want to make sure that it's not just a lecture, but the presentation, the information is shared, but there's always that time for interaction, for collaboration. And when I schedule presenters, I try to make that very clear to them that they need to come with at least one question or one opportunity for our advisors to be able to collaborate and provide their own perspective and provide their feedback. So we want it to be very collaborative. So for example, this month, since we do meet monthly, this month at the beginning in September, we had our pain center manager attend, and she reviewed different types of procedures that are done in the pain center, things like spinal cord stimulators and how they're done temporarily at first and then permanently followed after that. And then after her presentation, then she provided a tour of the pain center, which is another really great opportunity for our advisors to be able to see different areas of the organization that they may not otherwise have the opportunity to visit. So God forbid, we don't want them to be pain center patients, of course, but it gives them the opportunity to go back behind the double doors and kind of see what that looks like and what our patients experience when they come to us for care. Our presenter for next month in October, which is just going to be next week, is one of our newer orthopedic hand surgeons. So it's a great opportunity for him to get some face time with the group, for them to meet him. He can share the types of procedures that he does, typically the types of patients that he sees and treats. So it's good exposure for our new docs, but also a great way for the community members to meet them, to learn about what they do so that they can help assist us with referring their family and friends when appropriate. So every month it's different. We always have a different presentation, different topic, etc. So we do try to take tours as much as we can. So this photo was taken earlier in the year down in our urgent care area here at our York location. And we were talking about the kiosk process when a patient would present at our urgent care, and the flow for our patients when they first come in, and learning about all of those different steps, talking about patient expectations that they have when they come to urgent care and how are we managing those. So we try to do as many tours as we can. It helps to understand the layout of the department or the area that's being discussed, review signage and patient perception of the facility. But really the primary function of our PFAC is to serve as a sounding board to gain patient insight and feedback. So it's important that they're able to visualize what's being presented, because we can talk about our urgent care and the issues and challenges that we have with patient flow, but if we actually take them down there and walk them through and talk about it, they can visualize it a bit better and give their feedback and their perceptions as kind of an outsider, as a patient that can look at things a little bit differently than we do. So our PFAC does not establish goals, nor do they interact with our board directly. Instead, our PFAC reports through QAPI, which is like our quality council. The primary function of this is that they're a sounding board for projects and initiatives to provide that fresh patient perspective. As far as communication goes, we always communicate through email. That just seems to be the easiest way to reach them. We don't provide any formal orientation or training to our PFAC members. They simply complete an application and then they sign a confidentiality agreement, certainly because they might see patients, as they're walking through, or might see or hear things. So we certainly want to make sure that we have those confidentiality agreements in place. And currently our members do not participate in other hospital-wide committees. It is isolated just to our PFAC. This is an example of what our PFAC charter looks like. It basically just says it exists as an advisory resource to the administration and the staff. We have our guiding principles listed, membership eligibility, participation and attendance, etc. So I usually like to provide this to potential recruits. If I'm talking to somebody and they seem interested in the PFAC, of course, I do my best to kind of verbalize what it is. But then I also share the charter to say, here's all the nitty-gritty details of really what we do, what the expectations are. So I do reference this quite often. And this is an example of what our application looks like. So simple demographic information is collected. We ask, when was your most recent experience at OSS Health? What departments were you, interacting with? Do you have experience as an advisor elsewhere? Why do you want to become an advisor? And share how you can help OSS better serve our patients and families. So it's just a nice kind of intro to the new advisor for our team then to consider whether or not we want to extend an offer to join our council. So as far as adapting to COVID, so during the height of the pandemic, our meetings were, of course, transitioned to virtual only. Our in-person meetings then returned in June of 2021 when our organization began allowing patients to bring support persons to their appointments again. So since we were opening up and allowing other people into the facility, we felt like that would be an appropriate time to regroup in person. So that's when we transitioned back to that style. So we discussed the current status of COVID-19 in our area and the restrictions and modifications that the organization had in place at that moment. And for example, one month our CNO discussed changes to our visitor policy. So she wanted the PFAC's feedback on the best way to communicate the changes to patients and families. And we were able to receive that feedback and their personal experience, which then certainly assisted us with amending our policy when appropriate. So we did continue to meet, and certainly for several months, COVID-19 was a standing agenda item that we were always providing updates. You know, here's what we're currently doing. Here are some of the challenges that we have, and certainly the committee members were all very understanding of why certain decisions were being made. But it was great just to kind of keep them up to date on what we were doing, and then for them to also share with us maybe other healthcare organizations that they had attended or been a part of, kind of helped us keep an ear to the ground as far as what other people were doing. So it was very helpful to have that sounding board throughout COVID. So then as far as how is information from the PFAC shared with the rest of the organization, at the end of every monthly meeting, we do have an open forum where our members are encouraged to share any questions, concerns, rumors that they may have heard in the community. So then any concerns that are mentioned are taken to the appropriate individuals directly within the organization, and then follow-up is reported at the next monthly meeting. PFAC updates are also reported quarterly at our QAPI meeting, just so those folks are aware of what's discussed, suggestions that come out of the PFAC. That's the way our structure works with that meeting. And then just a few examples of feedback that our PFAC has provided over the years include a walkthrough during new construction, surgical guidebooks. These guidebooks are amazing. They're a wonderful resource of patient education that we provide every patient prior to their surgery. It goes through quite an extensive list of what to expect every step of the way, and it really does guide them through the entire process. So our PFAC has been instrumental in reviewing our guidebooks multiple times to help make sure that everything is in there that patients need and want to know, that it's written in a way that they can understand. So they've been very critical in helping us maintain the excellency with those guidebooks. They've assisted with a new light installation process that we had in our check-in area. So they provided feedback on that entire project. They recently reviewed our grievance letters. Certainly we know that CMS has certain guidelines and regulations of items that we have to include in grievance letters, but we also wanted our PFAC members to look at it from a patient perspective and making sure that, you know, the letters were written in a way that was expressing kindness and compassion and empathy. So they were able to kind of give us some feedback on those letter templates. They assisted with providing feedback on the lack of privacy in our check-in area, and so they've done some secret shopping to help us with that. We've pulled them in as we're in the process right now of renaming our inpatient unit. So, you know, we've been asking staff for their thoughts on what to name the unit. We extended that to our PFAC as well, just to give them a little bit of ownership with that. So that was a fun ask. And then they also assist us every year with our Patient Experience Week, which is a huge week for our department in the month of April. We have tables set up at all of our locations, so our PFAC members have graciously volunteered additional time to help man those tables and, again, just be another face for the organization to interact with our patients and thank them and celebrate them during that week. So those are all of the slides that I've prepared as far as my organization. I'm going to go ahead now and turn it over to Rob, and he can share about his organization.
Thank you, Rhonda. On behalf of GSPP, I want to thank everyone for the opportunity to share our story today. Just trying to advance the slide. 1 second. There we go. Before we get started, just give a little context and background about our organization. Good Shepherd Penn Partners is a joint venture between Penn Medicine in Philadelphia and Good Shepherd Rehabilitation Network in the Allentown area. We're comprised of about a little over 1,000 employees, and we treat about 33,000 patients annually across inpatient and outpatient settings in the greater Philadelphia and New Jersey area. We operate 4 service lines. Our outpatient therapy division has 26 locations, specializing in orthopedics, neurological, lymphedema, and pelvic floor therapy. We operate a specialty hospital in downtown Philadelphia. It's an 18-bed unit for medically complex patients who need to be hospitalized for over 30 days or more. We provide the physical therapy, speech therapy, and occupational therapy in our downtown Penn Medicine Philadelphia hospitals, as well as operate an inpatient rehabilitation unit called the Penn Institute for Rehabilitation Medicine that operates 20 general rehab and 18 brain injury beds. To get started today, a couple of overview objectives. One is we wanted to share our story about how the PFAC got started during COVID-19. We actually launched our PFAC in the middle of the pandemic and have been 100% virtual since then. With that, I wanted to really go over 3 areas that are key to our collaboration with our organization. They would be our monthly meetings, special projects, and then representation within additional committees within GSPP. And then lastly, to consider some future opportunities for GSPP as our Patient Family Advisory Council continues to grow. With that, before we get started in sharing our story, I think as you envision your own organization, you may be on a journey that has either a well-established Patient Family Advisory Council, one that is growing and finding new ways to be innovative, and then 3, maybe you're an organization that's considering starting a PFAC. And so with that, our hope is that there's opportunities within the information to collaborate and share along the way. So with that, we got started with our Patient Family Advisory Council in 2020 in the middle of the pandemic. And we started by establishing a steering committee. And what we did was we leveraged one of those opportunities, which is special projects. And I went to one of our well-established PFACs within our health system and asked if we would have 4 advisors join us in our organization on a journey to launch a Patient Family Advisory Council. And so we were able to bring a small group of people that had a lot of content and information in this area with a group of information that was interested but had not yet been exposed to the benefits of the PFAC community. So we brought together those 2 groups and started our steering committee. This really helped us in one, we transferred the knowledge between the 2 groups. We also established a short-term commitment for the projects to get an opportunity to learn about the PFAC. And then we organized and supported the work into small groups that we can help to move the project along in an efficient manner. We'll share with you today, if you're thinking about starting a Patient Family Advisory Council, our project charter, our elevator speech, the work plan, as well as the timeline that we had developed. Perhaps some tools, if you're thinking about launching, would be beneficial to you. With that, on screen is our charter. We took the time to develop this as a group. One, it gave us the why behind our initiative. It laid out the reasons and benefits of establishing the PFAC. It also gave us a scope for the steering committee as we then transitioned to the actual PFAC. And then it gave us very specific metrics and then milestones along the way to know that we're progressing the work. We also enlisted all the folks that were involved. And we purposely had 1 staff member and then 1 community advisor as co-chairs to lead the work. Our elevator speech is here in front of you. We thought this is extremely important to have a united message that we could all take out into our work areas as well as community to help frame the direction and the ask of the steering committee, as well as identifying those stakeholders that can help us in the work and building our new Patient Family Advisory Council. Okay, so as we said, we launched in October of 2020 our steering committee, and we started with this foundational work. We had identified 4 areas to develop some work groups. One was the council structure. The second was what was the communication plan going to look like. Third was the recruitment of advisors. and then how were we going to properly onboard those advisors to our council. In November, we started to come together and to form our work plan across those groups. We then divided into the work groups and moved each of them forward, and then would bring the committee back every so often to review that work. In December, we actually started to recruit members for our PFAC, and then transitioned in February of 2021 to start our very first PFAC meeting. So we started in October and finished in February of 2021. This entire time was during the pandemic. We were 100% virtual. None of the teams had met in person, but we were able to work in small groups and not only launch the steering committee, but then transition into our Patient Family Advisory Council. Okay, what we try to do is summarize, for those that may be thinking about starting their PFAC, what exactly each of the work groups worked on, and what was the takeaway. And so our structure group, if you will, they really helped to define our bylaws and the charter itself. We created a presentation request form, so anyone that wanted to come to one of the meetings and join had a way to do that. We had the agenda templates and the meeting minutes developed. We established the time of day that we were going to meet, which is the third Wednesday in the evening hours, 6 to 7:30 in the evening. And then we had the calendar all laid out for the coming year, as well as we started to develop a bio page for each of our members. In our recruitment work group, we developed an advisor position description. What were the characteristics that we were looking for in our advisors? We actually helped to draft an interview script for advisors when they first become candidates, and then started that outreach to family and community members. And then also, most importantly, too, advising and educating within our own staff and coworkers about PFAC and the benefits of the council. And with that, we identified 9 candidates to start the PFAC. Our communication group created a PowerPoint overview to help with that education, both internal and external to the organization. We launched a web page that housed a lot of the information. We actually created a logo, which you'll see throughout the presentation. And then we created a flyer that can be used to present to patients, can be placed in key areas throughout the organization as well. And then we also updated our volunteer webpage. This became the portal for folks to apply for candidacy. And then we also created a request online for folks that wanted to come and join the agenda. And then last work group, we had our onboarding. So once we identified folks and we were able to communicate with them, we wanted to make sure that we saw from beginning to end the onboarding of team members and advisors onto the council. So we looked at our volunteer process. We transitioned it actually from a volunteer program into our human resources team. We created an online volunteer application. We created a checklist, and then we had a packet created for folks that was ready to go. Everything is digital. Nothing was on paper, so that we can continue to communicate with folks on a virtual basis. So these were the 4 key areas. These were actually the takeaways that the group created by the end of the steering committee's work. So the structure and format that we moved forward with was having co-chairpersons, 1 staff member, 1 volunteer, having members to help us with the bylaws across the years, a communications coordinator, secretary, and then our advisors. The meetings, we asked folks to attend at least 9 of the 12 monthly meetings, and we do meet again each month throughout the calendar year. We hold a 90-minute video conference from 6:30 to 8 p.m. In the evening hours. So we continue to be virtual at this time. We have presentations from staff members during the meetings, and we keep the presentations to no more than 10 minutes. And then we want equal amount of 10 minutes of advisor feedback on that presentation or project. We keep it to a minimum of 3 presentations per meeting. So that helps us to build the agenda, allow space for conversation, and allow the agenda items to cycle through. And then we also have requests, and much like we got the GSPP PFAC started, was through ongoing projects. An example of this might be we're currently working on the after visit summary that a patient receives upon discharge to make sure that it is optimized and is clear and not confusing in terms of next steps after discharge. We did establish some terms for the folks that are serving on the PFAC, from our co-chair persons through our advisors and our staff advisors, as well as our volunteers. Okay. Some of the advisor attributes that we're looking for. Number one is we're looking for our patients or caregivers that have an experience and are willing to share their story with GSPP. Again, looking to work within effective relationships, not only with one another, but with our staff members, interactions and communicating well with diverse populations. We're also looking for folks that are able to think about and support many different topics and not be focused on just one particular area. The creativity of when the group comes together and shares thoughts and is critical thinking helps to move our initiatives forward. And again, having that commitment to the council itself and working together as a group to work to move the work forward. We do have some commitments we ask of the advisor. I mentioned about participating and joining the monthly meetings, but it's also in helping to support and join other committees throughout the organization, such as our patient safety or our patient experience committees. And again, I spoke of a little bit about special projects that might come along the way where our advisors would join that project and support it from beginning to end for a specific period of time. And in each of these opportunities, helping us to evaluate and enhance our services programs and the materials we use to educate, communicate with our patients. And as we mentioned previously, helping to maintain privacy and confidentiality in all of the activities that we participate in. And again, our advisors join as volunteers, so we ask that they continue to follow the volunteer requirements throughout the year. The size of our PFAC, we set out to have a maximum of 15 to 20 advisors. One area that we have an opportunity is to grow that. We're not quite at that capacity yet as we continue to do our recruitment. We want to represent, again, inpatient and outpatient programs that have diversity across the culture and religions, across the organization, as well as race and the ethnicity backgrounds, and also helping to represent the diverse socioeconomic backgrounds and educational backgrounds throughout our service area. Again, we also have staff members that join the committee, so we have a blend of community and staff members. We look to have between 4 and 10 members at a time, and again, being diverse through our providers, nursing, therapy, patient and guest relations, case management, and support services as well. Now, one area that's particularly important to us is the continued recruitment of advisors and the outreach not only to the community but to our staff members and colleagues is extremely important. You can see on the right there was a flyer that we had created and created both a digital and a paper format to be distributed throughout the organization. As we continue to spread the word about the PFAC, we ask folks to refer those candidates back to our co-chairs, and then we do outreach to those individuals and talk a little bit about their interests, how we can help support their candidacy, how they could see fitting into the organization. And then we have folks very often shadow or join one of our meetings to get a sense of the committee and how it might progress forward. And then we have folks apply online through our website. So advisor recruitment is definitely an important aspect of building the PFAC. I had mentioned earlier that our advisors join as volunteers through the volunteer service program. all of our volunteers are compliant with the hospital immunization and background checks. Again, we also mentioned about orientation. Once we have folks that are on the committee, we want to make sure that they're in a position to be successful. We've created a volunteer packet where they really receive everything from HIPAA compliance to standards of excellence, as well as emergency preparedness and infection prevention. And we review the information either in person or virtually if need be. And then we have our PFAC-specific onboarding packet, which includes everything bylaws to the meeting schedule and bios. And then also to help position folks for success, we'd like to pair an existing advisor with new members for a membership for an initial 3 months time period. Well, as I envision the GSPP PFAC, we are in a growth fashion. We got started in the midst of the pandemic. We met virtually to get started. We continue to meet virtually, and we have a lot of advantages in doing that. But as I look to the future and what our opportunities will be, expanding the recruitment and growing our membership is probably our #1 priority. With that comes the ability to increase our visibility throughout the organization and the community. And then also looking to connect, as we do today, and collaborate with other PFACs on information and best practices, collaborating on projects, and then having annual PFAC summits. And these are 3 areas that, as a health system in Philadelphia and Penn Medicine, we are currently working on together. We'll have our 3rd Patient Family Advisory Council Summit this coming year. So plenty of opportunities to continue to grow as we are going forward. The one thing that helps bring us back to the efforts, the information, and the initiatives is the why behind everything that we do. And Shannon is one of our staff advisors that was with us from the very beginning of the steering committee. And she shared with us words today of the PFAC goes beyond patient and family advocacy. It gives patients, families, and caregivers the power to become shared decision makers in their own care. As a provider, understanding the patient and family values and goals is key to achieving the best possible outcomes. We continue to grow in our efforts with the Patient Family Advisory Council. We hope today to share some of the nuts and bolts of how we got started, but also the areas of opportunity as we continue to grow and collaborate with Patient Family Advisory Council. With that, Molly, can I hand it over to you for any questions that we may have?
Thank you, Rhonda and Rob. That concludes the slide presentation of our program. Now we would like to begin with our question and answer period, and we do have some questions that have come up into the chat box. Okay, and I believe this first question is for Rhonda. And the question is regarding the background of the speakers and presenters that you have present at your PFAC meeting. You had mentioned that you had pain management and a hand surgeon, and they're curious about the other types of speakers that you've had.
Sure, great question. Thanks, Molly. As far as the background of our presenters, I don't necessarily have any qualifications that they need to have a certain type of background. I would just prefer the content expert relating to whatever the topic is at hand. So certainly if the team is wanting to learn more about our pain center, I'm going to go straight to the top and have that pain center manager come in. Recently, we did have some questions that came up during our open forum at the end of the meeting related to our billing statements, and one advisor expressed just some frustration and concern, feeling like she was not able to read our billing statement very well. So we reached out to our billing department and had our billing manager come over and kind of walk through those statements and identify areas of opportunity that we could maybe clarify some things. So it's really whoever the content expert is relating to the topic that's being presented or the questions that are being asked. That's what I look for when I'm scheduling a presenter.
Okay, thank you, Rhonda. And we have some more questions. And again, if you have any questions, please type them in the Q&A box found at the bottom of your screen. Please click on the three dots, then click Q&A to open the Q&A panel and direct your questions to all panelists, and we will try to answer as many as we can. Okay, and I have a question, and this can be directed to both of you. So if one of you wants to answer and the other one, the question is, have you ever had any dissatisfied patients become a PFAC member? Have you ever had any experience turning dissatisfied patients into PFAC members?
Hey, Molly, this is Rob. I could take that. The answer is absolutely. And I think those are patients or caregivers, family members, definitely to be engaged. They usually have great ideas, are willing to share their story, and then share perspective on how we can make it better. So yes, we definitely have PFAC members that have had challenging situations, and I think they're an important part of the group.
Thanks, Rob. And Rhonda, do you have anything to add to that?
Yeah, and I can share too. Thank you. I do have experience at a different organization of having that. And really it just came out of that relationship that was built with the dissatisfied patient while she was airing her grievance, airing her concerns and frustrations. So through those multiple interactions during the investigation and resolution of her complaint, we were able to establish a relationship, rebuild some loyalty and trust, which then led to an offer, you know, to see if she would be interested in applying and joining, which she did. So it was nice to have that little bit of a balance. You know, you want people on your PFAC that are going to be champions and cheerleaders for your organization. You certainly want that. But at the same time, I think it's healthy to have people that maybe didn't have a great experience with you, and then they can kind of share, you know, what their perceptions were, and it helps you grow and helps you get better. You want people to provide that healthy balance and not just individuals that are going to sing your praises and tell you everything that you're doing right, which certainly that feels nice, but I think it is good to have a balance of both.
Right, I absolutely agree with that. So thank you both. Okay, our next question looks like it's addressed to Rob, but they would like to know, what is the difference between a patient experience committee and a PFAC?
Oh, great. Thank you for asking the question. Yeah, so our PFAC, Patient Family Advisory Council, is centered in patients with the feedback and voice of our patients and caregivers. But we also have a patient experience committee within the organization, and its focus is working on everything patient experience related. So it's also working on processes. It's working on our standards of care, standards of behavior, standards of conduct as well. And so we actually have our Patient Family Advisory Council members serve on that committee to help us cross share of ideas. We also have folks involved with our patient safety committee as well from the PFAC. So we want the voice of the patient infused into these other committees. And so the patient experience is a little bit farther reaching in terms of the different types of experiences people have in outpatient and inpatient, and how we particularly make them better. Sometimes they're just internal conversations, and then sometimes we need the outside voice to contribute to that conversation.
Okay, great. Thank you. And this question also, for either of you, if you both want to provide input, that would be great. So do either of you have experience with PFAC members whose first language is not English? Great question.
So this is Rhonda. I'll take that one first. Unfortunately, I do not, and which is kind of ironic because I started my career in healthcare as a Spanish interpreter. So our patients who are non-English speaking certainly are a personal passion of mine to help ensure that they are provided, equal care and make sure that that communication happens well. So that's a great question. Unfortunately, I don't have any experience with that. I have not received any, applications or heard from any patients that they are interested, but certainly something I would be very willing to explore and look into in the future.
Yeah, this is Rob.
Thank you,
I can add to that as well. Unfortunately, no, we don't have any members that primary language is not English at this time. We have folks that maybe are bilingual, but English is the primary language. We are looking for diversity within the group, and again, an opportunity as we go forward with recruitment.
Right, and that's a great question because with PFAC, your members should be representative of the population that your facility serves. So that is a very good question. So thank you for that. Okay, let's see, I think we have a few more questions here. So this is addressed to Rob. What type of staff presentations do you have at your PFAC meetings?
Oh, great question. Also, I will say that there's probably two ways that we get questions. One is staff come forward, they request time on the agenda, and they'll do that through our website or direct email to me, that they're looking for feedback from the council. Sometimes the council asks, they'd like to learn more about, say, how the organization is conducting research. And so then I'll reach out to that department and ask them to come and present. But we'll have our nurses come forward, safety, how we can help with some signage that are on the units, some of our pre-admission documentation. Admissions team will come and present. We had our outpatient team present not too long ago about a new site that opened and some feedback on that as well. So it could be any of the disciplines. We have even our leadership come at the beginning of the year to present what the goals are and their feedback. So I would say the topics range from high in the organization to what our mission and goals are, down to the patient level, where just we have particular items that we've developed that we would love their feedback before we put it into play. And again, it could be nursing, therapy, support services, casework, social work case managers, and the like.
Okay, great. Okay. Again, if you have any questions, please enter them in the Q&A box or the chat. And this question is for Rhonda. How do you raise awareness about the PFAC throughout the organization?
Well, really, any chance that I get. So like I mentioned previously, if I'm trying to get some more presenters, if it's not something that I have in the pipeline, if I'm struggling for topics, I will send a blast email out to our leadership team just as a reminder to say, hey, don't forget, we have a PFAC that meets every month. Don't forget about this incredible resource, this sounding board to help you with your projects. So if I'm starting to come up empty and don't really have a lot of things in the works, I'll send one of those emails. Thankfully, it doesn't have to happen very often, maybe once or twice a year, that I'll send an email out. I'll usually get a few hits, in response to that, people requesting time. So then I'm able to get them scheduled. We also talk about our PFAC in our monthly patient experience newsletter as a way to help spread the word with the staff, just to, again, remind them that this group exists, remind them what its purpose is, and also that they can help with sharing topics and information. But a lot of it really is just through word of mouth.
Okay. Thank you, Rhonda. And Rhonda, this is a question for you also that you had mentioned Patient Experience Week, and they're curious, what is Patient Experience Week and what type of activities do you do during that week?
Yeah, so Patient Experience Week, I believe, was developed by the Barrel Institute. So it's an annual event. It's the last week in April every year. So if you check out the Barrel Institute's website, they usually post all kinds of resources and tools that can be used. Really, it's just meant to be a celebration of the patient, thanking them for choosing your organization, for being our patient. So we've done a variety of different activities over the years. Like I said, we usually have tables set up with just, some swag, things that people can take, whether it's, pens or cell phone holders, or one year we were giving away T-shirts. So just to try to generate some buzz and thank our patients for choosing OSS. One year we had a trifold board set up at those tables, and we were asking our patients the open-ended question that said, when you're a patient, how do you want to feel? And we were collecting their thoughts on that, and a lot of people said clinical type of things, like they want to feel better, they want to feel pain-free. But then we also received a lot of emotionally charged responses, things like, I want to feel listened to, heard, cared about, respected. So it was a great teaching opportunity for our employees then to take that feedback back and say, hey, look, when we asked our patients this question, this is what they told us, and kind of use that to drive even more of our patient experience initiatives. But we also want to make sure that during Patient Experience Week that we're giving our patients the opportunity to recognize staff. So we typically have opportunities and things on the tables to help promote that as well. If you had a positive experience, we want to hear your story. Can you please share it with us? What did the staff say or do that helped you have a positive experience? And then use that as an opportunity for recognition internally as well. So it's a fun week. We usually give away food and treats every day. We have different themes and, Crazy Sock Friday and stuff like that for the staff. So it is something that internally our staff typically look forward to every year. It's a lot of fun. It's a lot of work for our team, but it's a lot of fun.
Yeah, that's a great idea. I hadn't heard of that before, so thank you for sharing that.
Yeah, Molly, this is Rob. I could just add, we too have Celebrate Patient Experience Week. And what we've done the last couple of years was to center around one of our standards, behavioral standards. And this year we're celebrating cultural humility. But as Ron had said, again, celebrations, recognizing folks, activities. We're also promoting healthcare literacy this particular week as well. So it's a fun week to bring energy and awareness around the patient experience, but also maybe some of the standards behind it that help to build that experience for folks.
Great, that is awesome. Thank you. Okay, this question I have for you, Rob. How are the topics selected for your PFAC agendas?
Yeah, great. Thanks for asking. So, yeah, again, they come one of two ways. One, staff will bring it to us, and they'll either reach out to me or sometimes through our website. We'll sometimes put the agenda together, and as the concepts start to flow and make sense. We have a system of huddles and lean management at Good Shepherd Penn Partners. So our huddles are an opportunity for teams to talk in small groups, and they might be working on an initiative, and then somewhere along the line, someone will say, we should bring that to the PFAC for their input as well. So our huddles are a source of bringing the topics to us. And then, I did mention sometimes our PFAC members are interested in a certain area that we haven't presented yet or given exposure to them. With that, I'll reach out to different teams and departments to see if they'd be willing to come and present on a topic.
Great, thank you. And Rhonda, this question is for you. How do you ensure the community members are mindful of your patients' privacy?
Great question. So since we do meet in person, it's important that our patient family advisors are just aware that they might see and hear things that, you know, they're in a healthcare facility, it needs to be kept confidential. So we do have our community members sign a confidentiality agreement that just basically says that through this observation, they may see sensitive or confidential information, including medical records. Now, if we have any sort of presentation or program, and if we're talking about a medical record in general, we're certainly going to block out any patient information. It's not like we're going to be openly sharing anything about another patient, but just to cover ourselves, it's just a good idea to have those confidentiality agreements signed so that they recognize if they see something or hear something when they're in our facility relating to another specific patient, it's very important that they do keep that confidential. So we do have them sign those.
Okay, great. Thank you. And Rob, do you add to that?
Yeah, likewise, we bring our folks in, you know, through the volunteer status, and so we have to keep up with the volunteer status and continue to use all of the confidentiality portion of this. I think it's always a fine balance to give folks the most information they can, but making sure that we're maintaining HIPAA regulations along the way.
This educational offering provides a certificate of continuing education for 1.0 continuing education hours. Continuing education credits apply to Pennsylvania registered nurses only. To receive a certificate of continuing education, each individual requesting credit must complete an evaluation by including their contact information. If you are the registrant of today's webinar, upon exiting the webinar, an evaluation will be displayed in a new internet browser window. For those who did not register but are participating as a group, please participate in the evaluation by copying and pasting the link found on your screen or in the chat panel into a new internet browser window. Evaluations must be completed by 1 p.m. on October 3rd, 2022. I want to thank everyone for joining us today. If you experienced any issues accessing the evaluation and/or certificate of continuing education, please feel free to direct any inquiries to Shelley Mikesell at shmikesell@pa.gov. This concludes our webinar.